close to 90% of the general public has untreated sleep apnea.
If you don't sleep, your entire outlook on life is horrible.
She has been telling providers since the 80s that she has sleep trouble. In 2 weeks, I was able to get her to have a consolidated sleep.
Is it that you have more ADHD tendencies because you're not getting good sleep? Or is it because you're truly ADHD?
There's close to 200 sleep disorders out there.
Welcome to another episode of Hormones Uncorked.
Cheers.
Woo! We have a very exciting guest today, Miss Carrie Yamamoto.
Hello.
Yes,
We are so
and
happy.
she's one of my most favorite people, and I love so much about you, and I'll give an intro here in a second. But one of the things I love before I met you, everybody kept saying, "Have you met Carrie Yamamoto?
Oh my gosh.
Have you met Carrie Yamamoto? You would really
You're
like
gonna make
Carrie
her
Yamamoto."
She's very well known throughout
And
Reno.
I was just like, no. And I just kept hearing your name over
Yeah.
and over and over. And then the second I met you, I was like, yep, she's my person. Just because you're very real and you're
Yeah.
straightforward.
Thank you.
And you're a mama.
Mhm.
And, I love it. So,
Wait, let me
Thank
say,
you.
I want to say something real quick. I feel like I don't know Carrie that well,
yeah.
but she has been you have been so supportive of me and my business.
Absolutely.
Like, it has been so encouraging to see. And like Andrea and I talk about all the time, like, why can't women just build other women up? Like, we don't need to have this like
100%.
thing. And Carrie has been so great, and like, you're doing such a great job, and it means so much to me.
Good.
So
I'm
thank
glad.
you.
Yay.
Appreciate it.
Yes. So we love Carrie, and I wrote this down so I wouldn't miss anything. But Carrie graduated with her BSN in nursing from Saginaw Valley State and then worked at the University of Michigan. Did
Yes.
I say that correctly?
That is correct.
Okay. And then as a brand new baby nurse, you were doing pulmonary, critical care, and then
Yes.
eventually you and your husband, Dr. Kyle Yamamoto, moved to New York.
When did you
Correct.
graduate in nursing? What year?
2006.
Okay, I was
Does that make me the
2005.
oldest?
No, I was 5.
Okay.
So I was like, it's been 20 years this year. Oh, you're
Yes.
20 years next year. Okay.
Yes.
I love it. It's so awesome. And then you went on to become a nurse practitioner.
Yes.
So you graduated from University of Rochester, New York.
That's correct.
Was Kyle doing med school there or residency?
He was doing residency there.
Okay, cool. so
And-
that was a busy time.
That was a very busy time. And we got married
And when
at
you were
that
in New
time
York.
when we were both in his residency. I was at
Yeah.
the last year of my schooling. So it was
Okay.
very busy.
Yeah, that is
Amazing.
busy. Okay.
It's amazing. And,
And
then now you specialize in sleep medicine, but you have this long history of being in critical care, pulmonary. And when you were first here, right, you
Yes.
were working in the ICU with some of our other favorite people. No, you weren't with
No.
Dr.
So,
Veray then?
no. So when we moved here 10 years ago, I started clinic.
Okay.
I actually, and we don't have to put this on, but I always wanted, I'm an acute care nurse practitioner. So I always wanted to be in the hospital because I loved critical care and I wanted to run the units because that's where that's what it was like in Buffalo. And when we came here, they're like, no, we're good. And I'm like, okay, well, I didn't do clinical in an office setting. So it was brand new to me. But quite honestly, I absolutely love it because as nurses, we love to educate. And I got to see the progress of my patients and I got to see the improvement. And it was just so empowering for them and for me, So I've been doing clinic ever since.
Which is really
And
amazing.
over time, I noticed that sleep was my niche.
Yeah.
I did half pulmonary, half sleep, but
I
then,
remember when you were doing that.
sleep over the last multiple years, I started to focus on it more, including insomnia, which is not something that is really looked into deeper from a sleep medicine perspective. So in sleep medicine, it's, well, you can't sleep, here's a pill.
Right.
Yes,
right,
here's
right.
some sleep hygiene, but it kind of goes to that.
Right.
I looked further into that, and now I am starting to do what's called cognitive behavioral therapy for insomnia.
Oh, that's great.
Which tackles the behaviors of sleep. So essentially, I, look at everybody's sleep. It's a 45-minute to an hour consult.
Wow.
So I'm tackling every little thing about what you're doing about sleep, what's happening while you're sleeping, how it affects your day, and how you are feeling during the day. And then I reformat your sleep so that it actually looks better for you from the outside and in the inside.
That's
That's amazing.
Yeah,
Yes.
that's awesome.
Yeah.
I feel like, I'm sorry.
So
I feel like when I was like doing some research on like, not on Carrie, but like the sleep stuff, it's like besides hot flashes, which are a late symptom of menopause and perimenopause, sleep is the number one complaint.
Yes.
I can't sleep. I have insomnia. I cannot sleep. And if you don't sleep, your entire outlook on life is horrible.
Yes.
Right? Remember as new moms? Like,
Yes.
we're not sleeping. We are not in a good spot.
no.
We are
Yeah.
not doing well. You have to sleep well to feel well. Like, you just have to.
Correct.
So let's just do a scenario. If a woman, let's say they come to us for HRT and we're like, you're fine. Like, there's nothing going on. Like, obviously we don't want to say you're fine, but let's just say they're too early. Or they're too late to start hormones, so they're too early, and the progesterone is not the issue. What are we going to do to help them sleep?
Well, you can send them over to me or a sleep specialist.
Yeah.
Or what would be most beneficial is probably somebody that does cognitive behavioral therapy for insomnia, like me. So there is something about their sleep that is impacting the awakenings, the insomnia, the early awakenings. So looking at their sleep as a whole, like I do, I would be able to figure out those holes that they're doing. Because oftentimes, I like to tell my patients, I look at their sleep like a puzzle. Like, they're putting their puzzle pieces together. Some of them you're putting them in the wrong spots. But what I'm going to do is put your puzzle pieces in the right spot and complete your puzzle.
That's okay.
So I would have them get evaluated for potential sleep disorder.
Do you do like a sleep study with that as well?
Oftentimes,
Sometimes.
almost always,
Okay.
yes.
And
Because sleep disorders are very different in women than in men. So for women, oftentimes sleep disorders look like insomnia, anxiety, depression, fatigue, unrefreshed sleep. So somebody comes to you with those symptoms, oftentimes they're put on anxiety meds, depressive meds. They're looking up fatigue causes, right? But in reality, it could be an underlying sleep disorder. So
what do you usually see as like an underlying sleep disorder? Like what type of thing?
the most common is actually obstructive sleep apnea.
Oh, okay.
So the crazy part about that is if I bring it up, women will say, oh, I'm not snoring.
Yeah.
And only 60% of patients with sleep apnea actually snore.
And I think like that also like people think, oh, I'm not obese. Like I don't
Correct.
have a big neck. Like the things you see, I shouldn't have sleep apnea. And it's like, well, no, that's not always the case. And I think that we are not catching sleep apnea as much as we should. When I went to a Mayo Clinic conference, it said that the number one cause of AFib in younger people is sleep apnea that's undiagnosed.
100%.
Yeah.
So for the general public, close to 90% of the general public has untreated sleep apnea.
I wonder if like a sleep study should be part of a diagnostic criteria for a certain age.
I would love that when that
Yeah.
happens. Yes, it should be. It's one of my girlfriends. She said we should have a mammogram, colonoscopy, sleep study.
100%.
Because she was walking around with some of the most severe sleep apnea I've ever seen.
Really?
Yes,
And it was
Wow.
obstructive, not central?
it was obstructive.
That's yeah. So yeah, wow.
Mm-hmm.
So do you do sleep studies in your office?
We do home sleep studies. So
Okay.
that's something that's the myth is that you have to be in the
Yeah,
lab.
right.
But I can do about 99% of my sleep studies at home, next to your spouse, next to your animals, whatever you choose, because we want to emulate your sleep as much as possible, even though you're hooked up to something. And
Just
we
in the
know in the
comfort.
lab that isn't quite possible.
Right.
Right.
Mm-hmm.
And so what does that look like? Is that like electrodes on your head? Is it a ring? Is it a pulse ox? Like what?
So there's a couple third parties I use, and each one is a little different. So one of them use like a strap on the chest, a cannula, a little guy on your wrist connected to your finger. Okay. Others will do the around the wrist on the finger connected to the finger, and then others are doing the ring. Yes,
And I see you're wearing an Aura ring.
I am wearing an Aura ring.
Do you love
Yeah.
it?
Do you love
I
it?
do love it.
I think this is definitely a plug for Aura. Everybody
Yes.
loves it. Everybody's
Yes.
like
Okay,
obsessed.
so
feel
I
like
have to
we need
tell
get
you,
one.
and I think I told
Did
you
you get
this
one?
before. I had an Aura ring and I stopped wearing it because it was freaking me out. because I fall asleep super fast, like I was saying, and I'm in REM for a long time, like 3 hours a night.
We need to talk.
Yeah,
But
why would she be in REM for 3 hours?
I don't go, and I have the most vivid dreams. I almost lucid dream. Like I wake up and I'm like, that was really weird. How did my brain come up with that? I have very vivid dreams, and I don't go into deep sleep, like at all. Like maybe 30 minutes of deep sleep. And so I quit wearing it. And I was like,
Because it was trying to tell you
was
out.
smart. Yes. When you are starting to fixating on the numbers,
yeah, I was freaking
then
out.
you need to kind of like push that aside.
Yeah.
So I'm glad you did that.
Thank you for validating.
The consumer wearables are definitely helping sleep become more of an important aspect of somebody's health, but they're not the end all. And for example, one of my patients that has an Oura Ring, she did an in-lab sleep study, which is gold standard to diagnose and multiple sleep disorders, right? And when they looked at the architecture of the sleep, meaning deep sleep, REM sleep, light sleep, in comparison to the Oura Ring of all those architectures, it was not similar. It was like 10% off. And I was super disappointed because of the consumer wearables. The Oura Ring is actually the most credible.
Yeah.
So sometimes you have to take it with a grain of salt. Sometimes you have to push it aside. I take it with a grain of salt.
Right. It's just another tool to use.
Another tool.
Yeah.
Yeah.
Just to see. Well, that's interesting.
Yes,
But you like yours.
I do.
Yeah.
Mhm.
I did a sleep study once thinking that it would help, like, oh, I have migraines because I'm not sleeping. Did a sleep study. It was like, you're perfect. I was like, dang, that wasn't the issue.
I do get a lot of patients with migraines.
You do? Maybe I should do it again.
Yeah.
So
So how long ago was that?
Like 3 years ago.
Oh, okay.
because what I have been finding are patients that are coming to me who have seen other sleep specialists and they've been told they're fine. And I say, I want to see your sleep study that you did years ago. And almost always they have a diagnosis of sleep apnea that was never treated.
Why do you think there's such a high like incidence of sleep apnea?
Well,
Maybe it's always been that way. We've just never maybe.
yeah,
I don't know.
because even a few years ago, the percentage of undiagnosed patients was around 80%. So we're learning more and more about sleep apnea. Now it's, close to 90%. Why is that? I think we're learning more about it and how it really impacts our sleep and how it doesn't matter if you're obese or a man or if you snore. Like kids have sleep apnea. My child had sleep apnea
Mine
at
did.
5.
Mine did too.
That's
Yeah.
right.
Yeah. Oh,
Right?
he was
Grayson was
really bad.
scary bad.
So we think of this as an old person disorder, when in actuality, it is a lifelong disorder that can be looked at and discussed.
Right.
Yeah. And I think that people don't understand like the repercussions that come with not sleeping. Like it's not just like I don't feel well, like I mean, you know how we felt when we were back to like being moms. It's like it's so structural. Like
Yes.
can you talk about how it's like your heart is involved with your
Yes.
lungs and all of that kind of stuff so people are aware like what all happens when you're not sleeping for years?
So in particular, sleep apnea, how I like to describe it is your airway is nice and open. It's like a stent. Okay. But you take that stent out and all of a sudden there's relaxation, and we all have relaxation. Up to 5 times an hour is completely normal for us to have a relaxed airway or complete closure. After 5 is when you get the diagnosis of sleep apnea. Over time, if you have untreated sleep apnea, you increase your risk or can make symptoms worse related to diabetes, weight gain, difficulty losing weight, mental health is associated. So patients with anxiety, depression, others are not well controlled, okay? And then short term, if you sleep horribly, we're just not functioning
Right.
Our performance is poor, we're crabbier, etc. You increase your risk or make symptoms worse associated with Alzheimer's, certain cancers, high blood pressure, pulmonary hypertension, fatty non-alcoholic liver disease. The irritability on the heart comes because when the airway is relaxing or closing, your oxygen drops. When your oxygen drops, sends a signal to your brain. Brain isn't getting enough oxygen. Now brain tells the heart to compensate and work harder and faster. So that's where the cardiovascular comes into play. That can eventually throw it into that irregular heart rhythm, like you said, called atrial fibrillation, that can cause a heart attack, a stroke, death. So it's a big one.
Yeah.
Yeah.
I think that people aren't really realizing that this is such a huge issue.
So snoring is not funny. It's
Yeah.
very serious,
It is,
actually.
yeah.
Yeah. And I heard somebody say one time, like, if you saw somebody choking, you would not laugh. You would immediately go and help them and figure out what they need to open their airway, right? You Heimlich them or whatever. So essentially, when you see somebody snoring, you should have the same thought process of like, no, this is not funny. It's not a joke. They are literally not perfusing their vital organs, including their brain.
100%.
Right.
Yeah, it's very scary. I feel like, like I said, everybody should have a sleep study.
Yeah, 100%. I've had 3 myself.
You have?
Yes.
Yeah. And I mean, I think that also for us, it's like, we're aware of it, but like this is really good awareness too, because, women our age are saying, oh, I'm not sleeping. And we're like, oh, it's your hormones.
Yeah.
Or do I
Here,
not?
have some progesterone.
Yeah,
and
your
you'll be
progesterone
fine.
will help.
And that's not the full
and
end
that's
all
not,
be all.
and we're not. And I always tell my patients, like, I don't like to treat, like, I don't like to put Band-Aids on the problems. I like to treat the actual problem.
Yes.
And even with hormones, I feel like we are treating the problem, but maybe we're just putting also a little bit of a Band-Aid on the sleep issue. So
Correct.
That's good
Send
for
them
us
over.
to know.
Absolutely. Because women are the ones that get dismissed the most.
They are.
Because they don't have the classic symptoms like men do. So then as a whole, we're not sending them or we're dismissing, right? So the more that women can advocate for themselves, as I know that they're doing more, and I think the more that women talk to their friends and they're like, hey, I have this or I have that, and it's making women more powerful when they go to their provider and say, I'm having sleep issues. I don't want a sleeping aid. Can I be sent to a sleep specialist?
Yeah.
Can I actually try to find out the root of the problem if there is a problem? Right.
100%.
I agree with you for sure.
And in our community, right, like I think there's always a problem with getting into a provider in a timely manner.
Yes.
And so if for some reason, like they're trying to get into you, they're trying to get their sleep studies, sometimes those can be booked out for a while.
Yes.
What tangible ideas can you give to women to like, hey, try this? I think we all kind of know sleep hygiene to some extent, but if you could just run through that and like any pearls or tips or tricks.
So every sleep disorder has certain aspects that would be helpful to clean up on before they come and see a sleep specialist. So if there's a suspicion of sleep apnea, let's say the woman is snoring, try to be positional as possible. So on your side, try not to sleep on your back. If you have an elevated bed, do the elevated bed. Elevated pillows. I know people are like, oh, I sleep on 4 pillows, but when you start, moving around, all of a sudden it becomes 1 pillow or no pillows. One of those wedge pillows might be helpful. You could try online oral appliances before you go and see a provider as well to get the formal diagnosis. I mean, the cost is around $200, so it's minimal. Like, I mean,
do you feel like they work okay? Depends on what type.
It does. So, like, I see like the more mild to moderate, I will send them to a sleep dentist particularly. But while they're waiting for that appliance to be made, I will give them SnoreRx or Somnifit are the 2 that I would recommend.
Okay. That's good to know.
Yes.
And so like one of the things that we ran into with Grayson when we tried to throw him in a sleep appliance is that you have to remember if you're going to do a sleep appliance, you have to be able to breathe through your nose.
100%.
If you can't breathe through your nose, you're just going to spit it out.
Yes.
And so that was a really light bulb moment for me too of like, okay, this poor guy's sinuses are completely full and he couldn't do.
Yeah, it was so sad.
It was so
sad. When
sad.
you sent me those videos, my heart broke.
Oh my God. And I would
We were
just
like,
I would just chin thrust him all night long. And I kept moving him and chin thrusting him. And, my husband was just like, I really don't want him to get surgery. And I'm like, I don't either. That surgery is gnarly to recover from. It was really rough. But now he's grown so much since then. His behavior is improved.
His dark circles
his dark circles are so much better. And
kids in sleep apnea and adults look very differently. They're much more hyperactive and behavioral issues. So yes.
So would you say, I mean, this is totally opposite. Would you say that like kids that maybe have like some ADD symptoms should get sleep?
Yeah, for
that's
sure.
100%.
Yeah.
So, our community, we're finding more, because I'm passionate about this. There's a few pediatric dentists in town that are super passionate about kids and sleep. And I would highly recommend going to them if you are looking for answers. Because sometimes you can't find them when you're trying to search for the right person. Sometimes the pediatricians are unsure, right? So always be an advocate, just like you were for your son.
Yeah.
And it was distressing because even as a nurse practitioner and a physician, I was still
You were still
messaging
begging.
Carrie,
Yeah.
and I'm like, what do I do? I'm
Well, you were still
freaking
begging
out
to get him in. Yeah.
Well, right. And then, it's just airway stuff is distressing.
Yeah.
It's just, it is.
Yeah, absolutely. Because I do cognitive behavioral therapy, is a lot more than just sleep hygiene. So it is essentially changing the way you think and behave around sleep. So there's a lot to it. But things that I know that help patients. Number one, please stop looking at the clock in the middle of the night.
Like, don't look at your phone. You
Do
wake
not
up,
look
do
at
not
your
look
phone.
at your phone.
Once you are in bed, phone is away. Time is away. Okay? So bed equals sleep and intimacy only. It does not equal other things. Because when it equals other things like watching TV and stressing and thinking and anxious thoughts, ruminating thoughts, right? Then your brain goes, oh, well, this is what we do in bed. And then it'll keep getting worse and worse over time.
So I'm
when you
assuming
start-
you do not have a TV in your room.
I do not have a
No. Do
TV
you?
in my room.
No,
No, I
Travis
don't
won't
either.
allow it.
Neither will
Perfect.
Dan.
Perfect.
He is like, no TV in the room. I'm like,
Yeah. So set an alarm in the morning and you wake up to your alarm. That is the number one
Or you wake
thing.
up 20 minutes before your alarm, like I always do.
So I
And that
decided
can be very normal
just
too.
this morning, I was like,
Love it.
we need to plug our phones in the bathroom
Mm-hmm.
and just have the alarm because yes, it is a
But
problem.
what if I need you at 8:37? You go to bed at 8:30.
Dude, this is the problem. Carrie, I am in bed for 12 hours a night and I never feel
if
rested.
I text
It's
her,
a
it's like
problem.
8:20. I'm like, shit, she's gonna be a minute.
Okay, Miss Andrea, it sounds like you need to come see me.
Or I'll be like, 2 a.m. You think it's too early in the morning to respond?
You could send your First of all, Carrie
'Cause
said
I
not
won't
to
see
do
it.
that. She
I
said
know,
not
I
to do
won't
that. But
see
you can
it.
also send the text where you send it and then you can time it.
Yes.
But sometimes my anxiety is so bad when I wake up in the middle that I'm a business owner, right? I wake up and I'm like, oh,
Lots
I
of
gotta do this,
thoughts.
Yeah, you just write down.
Well, I can't because then I gotta wake everybody up.
Mhm.
So, but I put on my meditations, and so I'll put
Perfect.
in my earbuds and I'll put on my Peloton meditation, but that does require my phone.
Mhm.
So there's that. And Travis gets mad because sometimes I look on Instagram for like 5 minutes.
That's what you think is 5
25.
minutes.
and
25.
then,
yeah,
and then
20
I
minutes.
put on my
So
my
the goal
meditation.
is that you have consolidated sleep. The goal is
Right.
that you're able to fall asleep within 10, 20 minutes. Stay asleep. If you do wake up, you can easily fall back asleep and then wake up close to your alarm time, just like you do. So it's normal to take up to 30 minutes to fall asleep. It's normal to be awake in the middle of the night for up to a total of 30 minutes. So that is something that I think a lot of people don't know, that it's actually normal to wake up in the middle of the night, but it's not normal to stay awake.
And if you are not falling asleep within 30 minutes or you're staying awake for 2 hours, we should definitely get checked.
100%.
Yeah. Okay.
Yes. So, and that is where the insomnia comes in play. So insomnia is that for at least 3 months, for at least 3 days a week, that you're having the difficulty of falling asleep within that 30 minutes. And you're awake in the middle of the night for more than 30 minutes, or you're up way before your alarm.
Mm-hmm.
So there's three different aspects of insomnia. You don't have to have all three of them to have the diagnosis of insomnia.
And you treat all three of them very differently.
Yes.
So it's very complex.
It is a lot more complex. I actually have a student right now, and I'm like, "You thought you were just sleeping at night, didn't you?" And she's like, "This is wild."
Well, and I think it's good for people to know because they just think, "Oh, I'm going to take some Tylenol PM and go to sleep." Well, you're not actually resting.
No.
You
It's
know,
a chemical
it's the
induced
worst.
sleep.
Right.
Yeah.
And so it's, it's really good for people to know all of this.
Yes.
Like, I just can't take something over the counter or like that TikTok says I should take and go to sleep.
Yeah. Something else, and we talked about this before we started, is 2 key words go to bed, get into bed when you're sleepy. You're fatigued, you're tired. I know you want to be in bed, but you can't fall asleep. That is the difference between when to get into bed too. So sleepy is that you get into bed, you're able to fall asleep 10:20. Fatigue and tired is you get into bed and you can't sleep, but it's comfortable. So I want to stay. I'm so tired. I just want to stay. And I actually have to have my patients go to bed much later. It makes a big difference. Because then what happens is you're opening up that door for having sleep fragmentation or frequent awakenings at night. You're opening up that door to now waking up much earlier than you wanted to. So now you just shifted your circadian rhythm. So now you're going to be super sleepy again and tired that you want to get into bed earlier. So now you're starting this whole cycle over again.
What does like your sleep look like?
My sleep is I can fall asleep within probably like less than 10 minutes. I stay asleep. I maybe wake up one time. I tell my patients, I want you to zombie to the bathroom and zombie to go back. That is the goal. Get back into bed, go back to sleep. I do wake up to an alarm. And in addition, we have a blind that automatically opens at the same time.
Which is lovely.
Yeah.
It is quite nice. I highly recommend it.
Because you just don't want to get out of bed and just...
Yeah. Because bright...
open up. And
yes.
I'm like, oh, yeah.
Because bright light is really important in the morning for some of my unrefreshed patients that are still sleepy in the morning. And we're working on their sleep hygiene and the structure of their sleep. I do add bright light the first 30 minutes that they are awake for at least 10 to 15 minutes. Nice. So that can be looking like next to an east-facing window and just kind of feel like the sun. Obviously, don't look at the sun. Or it can be one of those bright lights that you buy, super cheap, like $20, and just as far away as like your computer screen. Again, you don't have to look at it, but it can be, there's a lot of clinical evidence that it's, number one, going to start your circadian rhythm. Number two, it's mood boosting, cognition boosting as well.
For sure. That's very interesting. Yeah,
I
do too.
Yeah.
These are all such great tips.
I know.
Everybody needs to go see Carrie.
Yes.
You probably, I'm assuming you need a referral from your primary care provider. You do not do not need a referral from your PCP. Okay. You want to tell us how
obviously it depends on your insurance. If you want to go through insurance and your insurance requires
Are you doing a cash pay place as well? You are? Okay. Yes. Tell us about that.
I do have patients that come to me if their insurance doesn't, work with us. So I always try to be kind during that. So I don't charge them the most. But that's still an option too.
Tell us about where you're at and all the things so we know how to get
I'm at Feminine Wellness. So it is the first and only multi-specialty clinic, women's clinic in Reno.
And they are fantastic.
We are lovely. I'm so honored to be there and to be asked to be there too. There's two gynecologists. I do sleep medicine and sleep behavioral medicine. So that's where that cognitive and behavioral piece comes into play. And then we have 3 therapists. We have injector. Yeah, we have it all. One-stop shop.
How many days are you working?
Just 2.
2. Yep.
Yeah. So
which is amazing.
It is. This is my. I tried to not work, and I couldn't stop listening to sleep podcasts, sleep conferences. And I was spending a lot of money on sleep. And my husband's like, you need to go back. So this is like fun for me.
Yeah.
This
She's
is my
as passionate
passion
about sleep as we are about hormones.
Yes.
It's just.
And injectables.
Yeah.
There's a whole, everybody's got to have their thing.
You got to have your thing. And I think when you have something on your heart, and you're
Yes.
constantly thinking about it and obsessing about it and dreaming about it and, getting so much joy from helping others.
Yeah, it's like how special is that we get
It's so amazing.
We get to have these jobs where we can help other people and we can also like help each other help other people.
Absolutely.
Like, we're so lucky.
Yes.
Yeah. When you see the difference, I see it in the patients' faces when they come in. They don't even have to tell me that they're sleeping better.
Yeah. It's in their eyes.
Yep.
It's
because you can
so
wear as
much
many
brighter.
masks as you want, but if you're not sleeping,
Oh, yeah. And
It's
when
not
you're not
gonna be good.
sleeping, you're cranky.
you're cranky.
Mhm.
So I now give people the benefit of the doubt. I'm like, they didn't have a good night's sleep.
You're so cute.
You see somebody in the grocery store, they did not have a good night's sleep.
Oh, yes.
Can you think of an example of somebody where you helped correct their sleep, and it was really impactful and something that stuck with you, and you were like,
Oh,
yes,
yes.
this is why I'm doing this.
There's so many different amazing stories. One recently, she was in her 70s. She has been telling providers since the 80s that she has sleep trouble.
Mhm.
In 2 weeks, I was able to get her to have a consolidated sleep.
That's so
That's amazing.
Did she cry?
She's like,
Oh,
I never
yeah.
thought this was going to happen. She would go to sleep for an hour or two, wake up for an hour or two, go to sleep for an hour or two.
That's
So what was the difference? Like, what was the magic?
You got to go see Carrie to find
You
out.
have to, yeah. So
Everybody's
It's
different.
probably
It's
different for
complicated.
everybody,
I feel like it's
right?
like a
Complicated.
prescription.
it is.
Everybody is different.
Everybody has
Yeah.
a very
Andrew's
unique.
looking at me like,
I'm like,
shut
but
up,
I want to know
Stacey, I wanna
specifically
know.
for her.
Yeah.
What
Yeah.
did
She
we
gave me
need
the
to
look
do?
of like,
So I know it's complicated. So I have to determine when she wants to wake up. I need to determine when she actually wants to go to sleep. We have to come to a realization that this isn't normal, because that's the other thing is there's so many people that say, well, this is how I've always felt. I thought this was normal. No, it's not. Okay. So how to scrunch her time in bed was we had to calculate how many hours she was actually sleeping. So let's say she's sleeping 6 hours, then your time in bed is 6 hours. So do you want to go to bed late or do you want to wake up early? So it's all based on like the patients guide me and I help guide them to get to that answer.
Yeah.
That's awesome.
That's
Right?
Well, this has been super helpful.
Yeah.
This has been
Thank you so much
amazing.
for coming on.
I'm so
Yes.
flattered that you asked
Like,
me and honored.
So much information.
Well, you have
Yes.
so much knowledge to give, and you are so passionate about this. And truly, we talk to women all day, every day, and they divulge all the things.
Oh, yes.
And I would say 100% of them
Mhm.
Learn
are
about
telling
sleep.
me, I am so tired.
Yeah.
I just cannot sleep.
Yeah.
And it's a real thing. It's a real problem. And I think it's discouraging because you just don't know where to turn
Yeah.
and you don't know what to do. And so if you,
And men, you do men. I mean, Carrie
do
does
men too.
Yeah, this
Yeah.
isn't just like a women. Yeah,
yes. But I mean, I
yeah.
interface with
Yeah,
women
me
all
too.
day,
Yeah.
right?
Yeah.
So
both. But
I 100% agree with you. I think the problem is that they talk about certain aspects, but there may not be a connection that it's actually associated with sleep. I'm so tired. Well, or I'm so fatigued.
Right.
I'm currently like leveling everybody's fatigue because it's amazing how many women are out there are on a daily basis, their fatigue levels somewhere between 4 and 6 and getting things done still. You know, we're powerhouses.
No, totally.
yeah.
And so empowering them to that, number one, you're in the right spot. Number two, I'm going to help you. And I'm going to help you until you feel better.
That's it.
Yeah.
Yeah. That's so great.
And I think too, you know, so many women are so used to just keep going, keep making it work, keep doing it. And while we may know intuitively, like, yes, these are the steps I'm supposed to be taking before sleep. This is how I'm supposed to be doing it. We're all very busy and we're all just trying to survive and cope. And maybe we're kind of skipping some of the things that we're supposed to be doing.
Correct.
And we maybe know it, but you just kind of,
Oh, yeah.
you know.
When I've been able to let my patients fly after I do CBT-I with them, I had one today come back and she's like, Carrie, so I haven't seen her since October and she's been doing really well. But she said when she started not sleeping well, she went back to the tools because I tell them I'm giving you tools because this will happen again. When you have chronic insomnia, you are still at risk of having insomnia after I have, you know, finished your building your puzzle piece together.
Right.
So I give you those tools that when that happens, life, death, stress, you know, work, that you know exactly what to do. And if they don't work, then you come back to me and I relook at everything.
Another game plan.
Oh, yeah.
Yeah.
Because there can be such, like, some patients come to me and I'm like, you know, things are okay, but there's still something off. And, you know, some of the things are light, the light in the morning. So, you know, they're like, oh, I'm still waking up early, too early. So most recently it was, she has a bathroom light that she can see. So it can be as simple as an eye mask, or because I don't like those, I will get something dark and put it just on my eyes as soon as I see the light because my alarm didn't go off. So I know I'm not supposed to wake up.
Oh my gosh, you're so
love it.
funny.
Yeah. Oh, yeah. Oh, yes. I do that.
Kyle's like, oh my God.
I'm a psycho.
I need to
about
have my
sleep.
sleep dialed down.
Oh, yeah.
That's good.
I am a princess.
Yeah, you need something, you come to me before my sleep hours.
Yes.
Because if not, that's my time.
Yep.
He
Good
has
for
to be-
you. We
oh,
have to have
yeah.
boundaries around things that are
Yes.
important.
Yeah. I am very lucky. He is a very quiet sleeper. He gets in quietly. 'Cause he knows. It's like, oh, yeah.
Yeah.
Were you yelling at me last night? I was trying to get to bed and you were shaking the whole bed. Of course I was going to say something, right? But he's like, mm-mm-mm. And a lot of partners do this to help their spouse that is struggling with sleep. There are sleep divorces. There's like around 90% of patients that have sleep divorces, meaning they're sleeping in separate bedrooms.
Oh, yeah.
Because one of them is disturbing the other sleep so much
I see it
that
all the time in primary care.
mentally they
Yeah.
can't take it.
Yeah.
Absolutely.
I mean, yeah.
Is that typically like a snoring thing, or is it they're just
It
tossing?
can be snoring. It can be tossing and turning. So I actually have a female patient right now that she had to leave because her husband couldn't deal with her moving around so much. So there is a lot more, like when you think you're sleeping at night, you're really not. There's close to 200 sleep disorders out there.
That's crazy.
Right? There's a lot of things
yeah.
that can happen in sleep. So something that I look at too is iron deficiency because restless leg is often, it's the third most common sleep disorder, yet it's not readily looked at, right? And so that is a big one for women. And then the movement while they're sleeping too, and men too.
That's good to know.
Yes.
Yeah, we look at iron a lot. But yeah, you're right. That's crazy.
Oh, yeah.
So I feel like if y'all are not sleeping, which none of you probably are.
I say everybody has
Go
something
see
I
Carrie.
can look at.
Yeah.
Oh,
Go
yeah.
see Carrie.
We need
Because
to like clone you.
I know.
Andrea and I are now going to be new patients, so
I
y'all should be
know.
too.
I've needed to be a patient for a long time.
Yeah, I mean, I think it's good for everyone.
Yeah.
And I
Just
tried
like
so
so
hard. I'm like, okay, we're going to turn the AC down. It's going to be 67 degrees
Perfect.
in here. And I shut off every single light. I like cover things. I have a fan going. I have a sound machine going. I meditate.
Love it.
I have like a whole thing. I do CBD. I do lavender. Girl, I cannot sleep. Well,
You're sleeping.
You're sleeping better.
I'm
Or
sleeping
sleep.
way better
Your
with my
quality.
progesterone. But like, there are nights when work is,
Yeah, you're just
Yes.
stressed, yeah.
So
I'm busy. I've got like 6
Yeah,
employees.
right.
Like I've got thoughts.
when that happens, when patients have ruminating thoughts and they're very similar every single night, we start worry time.
Oh.
Yeah.
Worry time
What
is
do
a
you do at worry
time you
time?
set aside at X time and you think about those things that you find that are causing you to wake up or you start thinking about in the middle of the night or when you fall asleep. And then you go what's in your control versus what's not in your control. And you can brainstorm out of those. And the goal is that when you get into bed, they start coming, you say, well, I thought about that at X time today. I don't do my best thinking right now. I'm going to think about that X time tomorrow. Now that is easier said than done, but it helps a lot of patients
Just
with their
kinda
anxiety.
compartmentalize, like, I thought about this. Now I'm going to put it aside and go to sleep.
Yep.
Yeah.
Because
Try it, Andrea.
I do
Let
try.
us know how you
I
do.
often am like, why are you thinking about this? You
I know.
can't
It's all
literally
little
do
things
anything
too.
about
Like,
this
I
right
didn't do
now.
that return today. Why am I thinking about that at 2
yes,
a.m.?
the
Yeah.
to-do list, the worry time, everything at a minimum of 2 hours before bed.
There you go. There's your pearl.
The problem is I'm so tired though, because I go from work to homework
Okay.
with the kids, then to lacrosse and then to basketball and food in there somewhere. And then somebody should shower at some point. And then
Yes.
you get the kids to bed and you're like, cool, I need to go to
Now
bed. I'm
everything-
exhausted.
Yep, you're exhausted, but your brain wants to go.
Yeah. And so I pass out and, then I wake up.
Yeah.
And I'm
so
like,
you're taking it now.
So you essentially are going to bed. I know you are exhausted, but we will.
go to bed too
I
early.
will.
Yeah,
Yeah.
you do. Yeah,
So
so
you're
the
wake-
8:30 cutoff is a little extreme.
It's okay.
listen, I need, if in a perfect world,
Mm-hmm.
You can turn your phone off to everyone
if
but
I can
me.
go to bed at 8 and wake up at 7, that is what my body likes to
Okay.
That's 11 hours. And the girl, me too, but that's not
But
happening.
sometimes I do, yeah.
So there's
Or
so many things
4
that are
a.m.
going in my
is
head
better
right
than
now.
6 a.m.
I feel like you need to make an appointment. When you get Andrea on the books.
But there could be there's
issues.
other sleep disorders like super sleepy disorders that
Oh, like
I think
narcolepsy.
narcolepsy is one of them, but idiopathic hypersomnia is another. Yes. So that is one where you sleep a lot of hours, but no matter how much sleep that you get, you never feel refreshed. You need long naps. And those are like the big signs, but there's sleep fragmentation, so awakenings. I like my sleep studies have some data that have arousals. And I really like to look at that because for women, and I kind of touched on this, Andrea, a few days ago, that they have symptoms of ADHD.
Gee, I don't have that at all.
And their arousals are numerous,
Yeah.
not associated with the airway issue.
Yeah.
That's
So we
interesting.
go, is there any possibility that you may have ADHD? 18 out of 20 women say, oh, absolutely. So ADHD and sleep are interlinked, and there's a lot of sleep fragmentation going on, a lot of sleep awakenings, but they're microarousals. So you don't even know that you're waking up, but oftentimes you're waking up refreshed. And women are often undiagnosed or missed with that one too.
That's what I'm saying.
Is that a
ADHD.
chicken or the egg, though, right? Is it that you have more ADHD tendencies because you're not getting good sleep? Or is it because you're truly ADHD and so your brain is so awake and scattered? I know.
It's hard.
Right?
That is a hard one.
Yeah, it's hard to say, I guess.
I don't know.
There's
It doesn't
a
matter
lot.
as long as you
You
can
gotta
figure it
treat
out.
one. You have to treat one and see how
Right.
the other one does.
Oftentimes I have the ADHD treated and I've seen great improvement.
Yeah, you got to treat one.
Yeah.
Yeah.
It's fascinating.
It is.
TMI, but I have tried to treat ADHD even on the lowest dose of Adderall. If I take 5 milligrams of Adderall at 5 in the morning, when I'm sleeping at night, my brain has so much to say. It's unbearable.
Maybe you're on too low of it. We can talk about that later.
Yeah.
But no, but it's like I do better when I don't take Adderall.
Mm.
Like if I don't take any Adderall, I'm fine. That's
So
why I don't
there's-
take it.
There's an
'cause I
amazing
can't sleep.
podcast that I just listened to. It's on Talk Sleep, and it was about ADHD and sleep. And they were saying that there is a possibility with all these ADHDers that are coming through that if they're on medication and it's not working, then maybe there's something else that could be a root cause of what's going on. So I would look at your sleep as a potential root cause. And if we figure out that you have an
that's
actual
true.
sleep disorder and treat the sleep disorder, that will actually
Then
improve.
maybe I
You
can
want-
remember to shut the cabinet doors in
Yes.
the kitchen.
Yes.
I turn around and I'm like,
Travis
who
would be
did
really
that? And I'm
happy.
like, oh, I did.
He'd be
Yep.
like, yay.
Whoops.
Mhm.
I know, poor
Yes.
Travis.
Oh,
My very type A husband,
it's okay.
who's
It's true.
very regimented. And
We
then
are
I'm
very
like,
lucky.
Yeah.
I'm very spoiled.
yeah.
All right. We should probably let her go.
Yes.
Thank you so
You're
much for coming on our
amazing.
podcast.
We love you.
learned
Thank you
so
so
much
much.
today.
Thank you guys so
All of
much.
us learned so much
You're
today.
amazing.
This
Yay.
is great.
Yes.
Cheers. Again.
Cheers. Yay.
Cheers. So
Uncorked.
Carrie's at Femme Women's Wellness
Mhm.
and call their office. Get on her books.
775
Carrie Yamamoto.
993 9292.
One more time. Sorry, Carrie.
Oh, 775 993 9292.
Joel will put that on the
Yes.
screen.
put
And
it
then,
on the
your
screen.
Instagram handle so that he knows.
Do you have a professional Instagram or
I'm not a
just
professional,
Okay.
but I like to talk about sleep mostly. I feel like
yeah, she talks about sleep.
And you send me really good memes and like
do.
you
Okay,
send
I'm
me
glad.
really good. I see I do see them and I laugh.
And she doesn't respond.
That's
And
all
then
right.
I don't
think that
respond
she
to
thinks that-
anybody. I don't respond to any. It's so
like,
bad,
she must
guys.
not think they're funny.
No,
That's
I think
okay.
they're so.
'Cause my
I'm
humor's a little
sorry.
off.
No,
I
we love
love
dark.
it.
We love
No,
off.
I
We
love
love
it.
dark humor.
I don't even respond to my text messages half the time, or my husband who's calling me for the second time.
Oh, okay. Yay.
Just put him on the podcast.
It's at
No podcast.
Carrie.Yama, YAMA 24.
Yay. Perfect.
I love it.
Yay.
Thank you.